For most of human history, a small cut could be a death sentence. An infected tooth, a scraped knee, or a simple surgical procedure often led to fatal illness. Before the 20th century, doctors had no reliable way to stop bacterial infections once they took hold. Disease, not injury, was the true killer. That reality changed because of one accidental discovery. In 1928, a Scottish scientist named Alexander Fleming returned to his laboratory after a holiday. While examining a stack of forgotten Petri dishes, he noticed something unusual. One dish had been contaminated with mold, but around the mold, the bacteria had vanished. Something was killing them. That something was penicillin. The mold, later identified as Penicillium notatum, was releasing a substance that destroyed bacteria without harming human cells. Fleming realized its potential immediately, but turning this observation into a usable medicine would take years of work and global cooperation. Before antibiotics, infections such as pneumonia, tuberculosis, sepsis, and syphilis killed millions every year. Childbirth was one of the most dangerous events in a woman's life. Surgery was a last resort, performed only when absolutely necessary. Even minor wounds could spiral into fatal blood infections. Penicillin changed everything. During the Second World War, scientists in Britain and the United States worked urgently to mass-produce penicillin. By the time Allied troops landed in Europe, antibiotics were saving countless lives on the battlefield. Soldiers who would have died from infected wounds survived. Survival rates skyrocketed. But the impact went far beyond war. Antibiotics transformed medicine almost overnight. Routine surgeries became safe. Organ transplants became possible. Chemotherapy, which weakens the immune system, could exist only because infections could now be controlled. Life expectancy increased dramatically across the world. Diseases that once terrified humanity became manageable. Tuberculosis declined. Bacterial meningitis became treatable. Childhood mortality plummeted. Antibiotics became the foundation upon which modern healthcare was built. What makes antibiotics so powerful is how selectively they work. Bacterial cells are fundamentally different from human cells. Antibiotics exploit these differences, targeting bacterial cell walls, protein factories, or DNA replication systems while leaving human cells largely unharmed. It is precision warfare at the microscopic level. However, this miracle came with a warning, one that science is now racing to address. Bacteria evolve quickly. Each time antibiotics are misused or overused, surviving bacteria adapt. Over decades, this has led to antibiotic resistance. Some strains of bacteria have become resistant to nearly every drug we have. This means the very discovery that changed medicine could lose its power. Modern scientists are now searching for new antibiotics, exploring bacteriophages, viruses that kill bacteria, and developing smarter ways to use existing drugs. The lesson is clear. Antibiotics are not just medicine, they are a finite resource. Yet their impact cannot be overstated. Antibiotics didn't just save lives, they reshaped civilization. They enabled modern hospitals, advanced surgery, global travel, and population growth. They altered the course of human history as profoundly as electricity or agriculture. All of it began with a forgotten petri dish and a curious scientist who noticed something others might have thrown away. This is why antibiotics are not just a medical breakthrough, they are one of the greatest scientific discoveries humanity has ever made. And they remind us of a powerful truth. Sometimes, the discoveries that change everything begin by accident. Follow Tech Obsidian for more episodes of science that changed everything, where we explore the breakthroughs that reshaped our world.